Hi, my name is Rowan, and today I'm going to show you how to perform a basic health check on a horse and foal. These are simple but important skills that can help you monitor the overall health and notice problems early. I'll be demonstrating how to check a pulse, calculate heart rate, take a temperature, evaluate gum health, listen to borborygmi, and perform a few basic foal checks. First, we'll start with checking the horse's pulse. One of the easiest places to find a pulse is the digital artery located near the fetlock. To do this, gently place 2 fingers along the back or side of the lower leg. You should feel a rhythmic pulsing sensation. Make sure to not use your thumb because your thumb has its own pulse, which can make it harder to accurately feel the horse's heartbeat. Once you locate the pulse, count the number of beats by 15 seconds. In this example, I counted 9 beats in 15 seconds. To calculate the horse's heart rate in beats per minute, multiply that number by 4. So 9 times 4 equals 36 beats per minute. A normal resting heart rate for an adult horse is usually between 28 and 44 beats per minute. Next, I'm going to take the horse's temperature. Before taking the temperature, I make sure the thermometer is clean and turned on. Stand safely beside the horse's hindquarters rather than directly behind them. Gently lift the tail and carefully insert the thermometer into the rectum. Hold the thermometer while waiting for the reading so it does not get lost or fall out. Once the thermometer beeps, remove and read the temperature. A normal temperature for an adult horse is typically between 99 and 101 degrees. If the temperature is higher or lower than normal, it can indicate illness, infection, stress, or environment changes. Next, we'll move on to checking the gums. To evaluate gum health, gently lift the horse's upper lip and look at the color of the gums. Healthy gums should be moist and pink. Pale gums, dark red gums, or blue gums can all indicate health problems. You can also check the capillary refill time. Press your finger against the gum until it turns white, then release. Count how long it takes for the pink color to return. Normally, color should return within about 1 to 2 seconds. Delayed refill time can indicate dehydration or poor circulation. Next, I'm going to listen to borborygmi, which are normal sounds made by the intestines during digestion. Usually, a vet will use a stethoscope, but you can just place your head on the side of the horse's stomach and listen to the horse's abdomen. The abdomen is divided into 4 quadrants, so it's important to listen to multiple areas. You should listen for a minute and hear gurgling or rumbling sounds that indicate the digestive tract is functioning normally. Reduced gut sounds, excessive sounds, or no sounds at all can sometimes indicate digestive stomach upset or a colic. Because the horse's digestive system is so sensitive, monitoring gut sounds is an important part of a physical exam. Now I'll demonstrate a couple of checks that can be performed on a foal. First is the gum check. Just like an adult horse, gently lift up the lip and evaluate gum color and moisture. Healthy foal gum should also be pink and moist. Since foals can become dehydrated or sick quickly, monitoring gum health is especially important. Then I'll perform a rib check on the foal. Gently place your hands along the foal's rib cage and carefully feel down both sides of the chest. During this check, you are looking for any swelling, pain, uneven areas, or abnormal movement of the ribs. It is especially important to make sure the foal does not have any broken ribs, because rib fractures can occur during birth, especially after difficult deliveries. Broken ribs can be very dangerous in foals because sharp bone fragments can potentially damage the lungs or other internal organs. Some foals with rib fractures may show signs as difficulty breathing, pain when touched, swelling along the chest, or reluctant to nurse and move normally. Early detection is very important so that a foal can receive veterinary care if needed. When performing this check, always handle the foal gently and calmly to avoid causing any additional stress or discomfort. In conclusion, performing routine health checks is an important part of taking care of both horses and foals. Monitoring vital signs such as pulse, temperature, gum health, and gut sounds can help identify illness or injury early before problems become more serious. Simple hands-on evaluations, like checking a foal's gums and ribs, also provides valuable information about their overall health and well-being. By becoming familiar with what is normal, owners and caretakers can respond quickly when something seems abnormal to help ensure that their horse stays healthy and safe. Thank you.